we also have a mission to try and prevent those injuries from happening in the first place. The number one reason that children come here, the number one reason that they're hurt or even killed, are the injuries because of accidents that are preventable. So in order to have a vision, to make our vision a reality, as leaders, we will take great care of children after they're injured, but it's also our responsibility to prevent those injuries from happening in the first place. We have an injury prevention center that is dedicated to ensuring that kids in our state stay injury-free. We do that through research, community programs, educating physicians and school teachers, working with parents, and advocating for and supporting policies that keep children safe. This is critical work that happens in our hospital and in the community every day. It directly benefits children and families from everywhere across the state. And so we have an important message to share with all of you. I will say personally that this has been very helpful information for my family. My wife left yesterday for Thanksgiving holiday and had a suitcase filled with gifts for our grandchildren. And we had to go through each one, make sure that they were safe before we started distributing them. And we hope that that message will resonate with parents and grandparents all over the state. So it is now my pleasure to introduce Sam Donahue, ConnPIRG Associate, who will present the report. I did owe Petra.
We'll both be speaking. Thank you, though. Thank you so much. And I'd also love to thank the Connecticut Children's for hosting us today. And thank you all for coming. My name is Petra. I'm the campus organizer with the Connecticut Public Interest Research Group Education Fund. And Sam here is a student at UConn who's also working with us on these. We're a nonpartisan public interest advocacy organization that stands up to powerful interests whenever they threaten our health, our safety, our financial security, or our right to fully participate in our democratic society. And I'd also love to thank Senator Blumenthal and Dr. Rogers for joining us so we can talk about how we can keep children safe. So today we are releasing our 34th annual Trouble in Toyland report, which I have a copy of here we can go over. When we started releasing Trouble in Toyland 34 years ago, visible and hidden dangers were in a significant number of toys. There were no limits on toxics like lead and cadmium, choking hazards were sending kids to the emergency room, and recalled toys were often found for sale. Each year, our report found dozens of unsafe toys for sale and noticed regulators lacked the ability to keep kids safe. We live in a safer world for kids today. For the last 33 years, our Trouble in Toyland has uncovered high levels of lead in fidget spinners, smart toys with data security flaws, choking hazards, and other dangers for sale. By revealing these threats, the report led to more than 150 toy recalls, resulted in legislation like the Consumer Product Safety Improvement Act to remove threats from store shelves, and empowered parents to take key actions to ensure that toys are safe. Toys have become safer over the last 3 decades, but dangerous and toxic toys are still on store shelves. With that in mind, parents need to be vigilant to keep their kids safe, and manufacturers and regulators need to take further action to ensure all toys are safe before they end up in a child's hands. Still, problems remain. According to the U.S. Consumer Product Safety Commission, hundreds of thousands of children go to the emergency room every year for toy-related emergencies. This year, Trouble in Toyland's report identifies 3 categories of hazards in toys and what to do about them. We'll be going over them, but they are detectable dangers, hidden toxics, and recalled toys. And Sam will be going over our examples.
Sure. So right here we have obviously a layout of some examples. We'll be going over some specific toys. So I will be going over some things to look out for parents and some pretty simple in-home tests that they can do at home to kind of hopefully prevent and mitigate some of the dangers that toys pose to children. Like Petra said, these include choking hazards, extremely loud noises, and some toys with toxins or ones that are really intended for adult use. So first, I'll start with the choking hazard. So obviously small toys or pieces that break off toys do pose a choking hazard to young children. In fact, in the last year, UV connecting bath toys and hundreds of thousands of wooden vehicles sold at Target were recalled because of the choking threat that they pose to children. You can actually do a pretty simple in-home test though for choking hazards. So we have here, pretty fun fishing game. But unfortunately you can see these small pieces, they break off pretty easily. They're designed to come off. And you just take a toilet paper roll, and if you can drop it through, that comes at the other end, it's probably a choking hazard. So So you should really probably keep this away from children that are under 3. And for parents with older children, you should really monitor their use, make sure they're not using it alone. The other major category of choking toys are underinflated or uninflated broken balloons, and they are in fact the primary cause of suffocation deaths from toys. Okay. The second detectable danger is excessively loud noise, which can cause hearing loss, especially in children whose hearing is just developing. It can be more sensitive than adult hearing is. Our audio test found that actually Hack Toys battery-operated police car and Kiko's light-up noise blaster likely violate noise standards set by the U.S. Consumer Product Safety Commission. And again, these could potentially damage a child's hearing. Here we have the noise blaster. Right. And it's a pretty simple test. If you just hold it up again to your ear, and it's too loud for your ear, it's probably too loud for your child's more sensitive hearing. In contrast, we have this airplane toy here, which, let me turn it on. I think you can hear the audible difference there, where it's obviously a little bit quieter, safer for children. Okay, now moving on, right here, we have some magnets. And in just over a month, actually, these might seem relatively safe or innocuous, but in fact, in just over a month, 2 doctors at Dornbecker Children's Hospital in Portland, Oregon actually removed 54 small magnets from 4 children. These types of small, powerful magnets are used in toys like construction sets, education tiles, and sculpture kits, and they can cause serious harm and even death when swallowed. You can see they're pretty strong, and obviously, you know, they pose a choking threat, or they can be dangerous if ingested for children. Unfortunately, toy safety standards were overturned for magnets in 2016. The Consumer Product Safety Commission should propose new safety standards for these magnets. In the meantime, parents should really keep them out of the reach of children. Okay, moving on. Another category that we found in the report uncovers hidden toxic dangers found in many toys, including borax, lead, and cadmium. And in recent years, actually, slime in all different varieties has become a pretty popular toy for kids. It comes in, you know, multicolored, neon, do-it-yourself kinds of things. And for a second year in a row, our testing revealed levels of borax, which is a compound that contains boron, that exceeds safety standards set by the European Union in 4 out of 4 slimes tested. Let's see here, slime. Straight. Okay. And this includes mixing agents as well, which contain actually 75 times the European Union standard and no clear warning label not to ingest. Ingesting medium to high doses boron can cause nausea, vomiting, and other long-term damages. And currently, actually, the U.S. has no limit on boron in children's toys or even warning label requirements. Parents, you know, may leave kids alone with these toys, and I think we know it's a pretty good chance if you leave a kid alone with a toy, they're probably going to try and put it in their mouth. And without warning labels, parents are really unaware of the potential danger that these toys can cause. So what we're calling on policymakers to require labeling for children's products with high boron concentrations and to set health-based safety standards for children. Thank you.
Great. So the last line of defense against dangerous toys is the recall system, which removes toys found to be dangerous from the market. Unfortunately, these toys often remain for sale on resale sites or in use because parents are not properly notified about the recall. During our report process, we were able to find Cheer's Kids Musical Instrument Set and VTech's Musical Elephant Shaker, both for sale, which were both recalled more than a year ago. And so before using an older pre-owned toy from an online marketplace, garage sale, or passed down from a family member, parents should confirm that the product has not been recalled by visiting saferproducts.gov. And the CPSC and manufacturers need to do more to notify customers directly that a toy has been recalled through direct notification as well as aggressive marketing. Kids are safer than ever from these hazards thanks to years of hard work by consumer, public health, and parent advocacy organizations, along with elected officials and the U.S. Consumer Product Safety Commission. But with new threats appearing and old threats still lurking, there is more work to do to prevent children from ending up sick or in the emergency room instead of joyfully playing at home. In the meantime, anyone who is about to buy toys for a child this holiday shopping season should visit our full set of tips at toysafetytips.org, which we also have on the poster up here. So you can learn how to evaluate potential risks and learn about some of the more of the toys that we have found to be hazardous. Thank you very much, and I'd also like to introduce Senator Blumenthal.
Great.
Thank you so much.
Thank you. Thank you to Petra and Sam for your great work. I've been doing this for a lot of years. I hesitate to tell you how many, but the problem simply doesn't go away. And as Jim said, thank you, Jim, for, again, being part of this effort. It is a kind of pre-holiday warm-up and warning. But I want to begin by thanking the Connecticut Children's Medical Center because for all these years, it has been at the forefront of children's safety every year, year after year. It provides support for this program. And the Connecticut Children's Medical Center is truly a place of medical miracles. The docs and nurses and staff here save lives in ways that are really so inspiring. And I wish before we came to this room, we could walk around the Connecticut Children's Medical Center and just see all that is being done to save lives from ferocious, vicious diseases that are beyond our control, just unfair to children, especially at this time of year, because it would make all the more dramatic the fact that we can prevent injuries that also kill children. With all the unjust, vicious diseases out there that take kids' lives or make them suffer, why not prevent that suffering at this time of year with a little bit of care and caution? That's why we're here. And I'm going to focus on some of the old menaces and one of the new ones. The old menaces are the balloons and the magnets. The balloons and the magnets have been around for a long time, and every year they cause the same kinds of absolutely preventable injuries. Parents and caregivers think balloons are fun. Kids think they are absolutely wonderful. They think they are so wonderful that they often put them in their mouths after they are broken. I'm going to try to break this. A broken balloon, a part of a balloon, can be swallowed or ingested and cause suffocation. That's a really simple fact of life. A deflated balloon, the same. So balloons are potential killers. They can cause emergency room visits. They can turn great celebrations into trips to the hospital because a child can swallow them or ingest them. And the same is true of magnets, those small but powerful magnets. Look absolutely harmless. You can take them apart. They seem to be magically, I mean, there is something almost magical about these magnets, right? They're colorful, they're attractive, they're easily swallowed. And then another trip to the emergency room. So this is all just basic common sense for any parent. But we all know that at the holidays, common sense sometimes is abandoned in the exuberance and excitement of the moment. And that's why some real care and caution is required. Every parent knows that often the greatest danger is at the time when you are looking the other way, when you're distracted, when you're talking to a relative and a child is on the floor eating a balloon or swallowing a magnet. So let me deal now with the with a new threat. And I don't know that Sam mentioned it. If you can talk to a toy, beware. There is no telling where that voice is going, what is being done with the information, and what invasion of privacy and what threat to the child may occur. If you can talk to a toy, sounds like fun when the toy talks back, right? Well, connected toys, guess where they're connected to? You don't know. They take down your address, the child's name, possibly age, preferences, voice recognition, all connected somewhere out there in the ether. Invasion of privacy with toys is a real and present danger. And as visible and dramatic as the choking hazards and the poisons from lead and cadmium may be, privacy invasion is just as threatening. Think about it. A child's voice with statements about age, food preferences, maybe where they like to go, all of it part of big data and an invaluable source of information for the big tech companies. So that's why care and caution are required in this new age of interconnected devices for children as well as for adults. And no one is going to ask your consent. There isn't an opt-in for your child. There isn't a place for them to sign and say, I'm opting in or I'm opting out. They are connected regardless of their choices or preferences. You're making the choice for them, and you're putting them at risk if you buy one of these toys without knowing where you're connected. So that is a new threat. It is rising, by the way, not diminishing, and it is every bit as perilous as the threat of suffocation or poison or threat to ears and so forth. So just keep it in mind. And with that, as I do every year, I have the great privilege of introducing one of the great docs in the world. He is an emergency room physician who takes care of children when they come here with these kinds of injuries, and that is Dr. Stephen Rogers of the Connecticut Children's Medical Center.
So good morning. Thank you all for being here and giving me the opportunity to share my concerns about the safety of children in Connecticut. I'm a pediatric emergency medicine specialist, and I'm also a research scientist at Connecticut Children's Injury Prevention Center. These two positions give me a unique perspective on the injury spectrum. On one hand, I work in the emergency department with dedicated staff that help to provide specialized care for children who are sick and injured 24 hours a day, 7 days a week. On the other hand, my colleagues and I at the Injury Prevention Center conduct extensive research, community programs, and advocacy to help prevent those injuries from ever occurring. We're heading into the country's busiest toy buying season. So even though millions of toys are recalled each year, we can't just assume that all toys are safe. Every 3 minutes, a child is taken care of in an emergency department for a toy-related injury. More than half of all these injuries occur to children that are 5 years or younger. And many of these young children are injured due to small toys or choking hazards, as my colleagues pointed out earlier. So we definitely need to avoid magnetic toys and toys with small parts when it comes to our smaller children. In terms of our older kids, the big risk is really riding toys like scooters. So we always have to make sure that these children have the right safety gear, especially helmets. And we want to make sure that we supervise our children while they're riding these toys and talk to our older kids about safety rules. All of these things usually happen at home, and they're all preventable. We think the big risk for kids outside of the home this year may be portable electronics. Many children are going to receive new phones, headphones, and other potentially distracting devices that they'll be using in our communities. So we need to make sure that we talk to our kids about safety ideas around using our phones and headphones. We're concerned that there have been more pedestrian-related injuries due to these distracting items. So parents this year, please, think safety first when buying toys. Start by picking age-appropriate toys. Inspect the toys to make sure that they're safe. And supervise your children while they're using them. And that means getting down and actually playing with the toys and your kids, not just being in the same room. I'd like to close, as I have in many years past, by saying this holiday season, the best gift you can give your child is a safe and loving environment and spending time with them, because that's what they'll remember when the toys are all gone. So on behalf of Connecticut Children's, we wish you a safe and happy holiday season. Thank you very much.
I want to thank Sam and Petra for all of the work that they're doing with ConnPIRG and helping keep our kids safe. And Senator Blumenthal, thank you so much. There's no greater advocate for safety and for children's health than the senator. We're so grateful that you're here today.
Thank you.
And to Dr. Rogers, there's nothing we'd like more for him to be doing than conducting his research and educating families and schools rather than extracting balloon fragments from a child's throat. But he does both. And so we hope that people will heed this message, and this will conclude our formal remarks. We'd be happy to answer any questions. Okay.
This is a first for this presentation.
We covered it all.
But thanks to ConnPIRG, and thanks again,
Thank you so
Jim,
much.
and thank you as always, Dr. Rogers.
Have a safe and healthy holiday. Thank you all.
Yeah.